Not those of Vic Canellis Media Group, its parent, affiliates, or stations. VCMG Live is not responsible for any content, information, or opinions expressed. User bears full responsibility for their reliance on such content, information, or opinions.
Presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Welcome back to another episode of You and Your Doctor, sponsored by All County Healthcare. Our number is 954-717-7027. We're a Medicare-certified home healthcare agency servicing Palm Beach County, Broward, and Miami-Dade. I'm your host, Louise Gomez. Welcome to the show. And today we actually are live at Sunscape right here in Boca Raton, 22501 Boca Rio Road. And the number is 561-680-3600. And we have two lovely guests, Lorie Rolat, Director of Community Relations, and we also have Stefanie Mardar, Director of WALK. Thank you for coming.
Thank you for having us.
I appreciate it. I appreciate it. And I was super excited to come here. I literally live like down the way, super close. I was like, I've been wondering what this beautiful place is all about. So can you tell me a little bit about this grand opening and how you play a role in that?
Sure. So Sunscape of Boca Raton is a new assisted living and memory care community. We will be opening up this September.
Oh, okay.
We are a luxury boutique community that offers hospitality services, assisted living services, that people that need help with their activity with daily living, and also assistance for residents that have dementia and Alzheimer's in our Vallejo memory care community.
Okay, wonderful. And so can you get a little bit more about what you do, like as far as the role you play here?
Sure. So as the Director of Community Relations, my job is twofold. I'm responsible for being the first point of contact for families, introducing them to Sunscape and our services and see if we're able to help meet their needs. I'm also responsible for all the outreach and letting the community know that we exist and seeing how we can help the community help their loved ones as well in regards to also business development.
Right. And Stefanie, thank you for coming. So can you share with us a little bit more about your role and how you interplay with Sunscape?
Sure, absolutely. Thank you for having me.
Of course.
So I am the Director of WALK with the Alzheimer's Association. So I strictly work with our volunteer base in the Boca Raton area, planning and executing our Walk to End Alzheimer's that takes place annually.
Okay.
So our walk this year is on Sunday, November 12th. And I work with Lorie. She's actually one of our volunteer committee members, serving as our logistics chair for the walk. And so we're able to partner together with Sunscape throughout the year to hold events like we are today.
And how long has WALK been doing this, these types of events?
Sure. So this is actually the 10th year for our Walk to End Alzheimer's here in Boca.
Wow.
So in general, across the country, we have
Right.
over 600 walks in communities in the nation. And walks have been going on really since the 80s. But for our Boca Raton community, this is the 10th year, which is really exciting to be able to celebrate with everyone.
So how can people, if people are interested in signing up and joining that team, how can they reach out? What can they do to?
Sure. So they can go online and visit us at alz.org/Boca, or they can call our 800 number, which is not just for our walk, it's for any services they may need if they are dealing with Alzheimer's or another dementia in their family. And that number is 800-272-3900.
Nice. So I love the theme, the artist theme. Can you tell us a little bit more about, I was pleasantly surprised when I came in and I saw all this artistry and beautiful work. Can you tell us a little bit more about what this entails?
Absolutely. So the Boca Chamber of Commerce in August hosts a monthly Boca Festival Chamber Days. in which the for-profit member partners with a non-for-profit. They put on an event, they sell tickets, and all the proceeds go for the non-for-profit. So it was a natural thing for us to partner with the Walk to End Alzheimer's, as we are a memory care community. And both my executive director and I have been on the walk for Boca for the past 2.5 years. And we partnered also with the Brooklyn Cafe with Freddie and Dawn.
Yes.
And they were able to bring in 13 of their artists that we're able to showcase. And our culinary team made some delicious food and drinks. And all of the tickets, all the proceeds are going to the Sunscape Walk to End Alzheimer's page.
Nice. So, someone curious and wanting to know more about Sunscape, so they would contact you since you're the community director. So they would. Is there a website, or can you give us some information?
Absolutely,
What
sure.
is the website?
So the website is sunscapebocaraton.com. The main number is 561-680-3600, and they can ask for me, Lorie Rolat.
Wonderful. And so I know it's been in the works building for now quite some time, and it looks so beautiful. Is our spaces filling up, and how does that work as far as
Yes, that's a great question. Yes,
Yeah.
we've been very excited to open up the community. We've experienced, delays like most other
Sure.
communities here. That being said, we are planning to move in residents as of September 1st. Right now we have 20% reserved
Okay.
in both our assisted living and memory care communities. And anybody that wants to come in and see the community and get more information can reach out to me at any time.
You say 20% now, but I have a feeling it's going to go like quick because, by the time they open in September, I have a feeling it's going to be a lot more filled up because I think you're getting the word out and people are visiting and whatnot.
Agreed. And there's also a need. There's a need for
Yes.
assisted living. There's a need for
Absolutely.
somebody that has memory care. So once we're able to accept residents, we feel that we will be filling very, very quickly.
And so what type of, because people want to know if they're going to put their parents, somewhere, they want to know, like, what type of community engagement will they have? Like, what types of...
There'll be a lot of different programming.
Okay.
There will be programming such as music. And
Nice.
so in our memory care community, there'll be a lot of therapy. There'll be pet therapy and art therapy.
Nice.
We'll have a lot of different, raised garden boxes and crafting. In assisted living, we're going to have different kinds of lecture groups and stimulating conversations. And we definitely
like
have a
that.
craft room or card room for those that are playing canasta, mahjong, and bridge.
Right.
And again, entertainment throughout the community.
That's what's needed, that sense of community, because so many people feel, worried if I'm going to bring my parents somewhere, are they going to be lonely? Are they going to have but this place, being that it's so new, I feel that you're going to establish a beautiful community because it's in a great area, and it seems like the doctors or the workers, I should say, that will be here, I'm sure are wanting to work in a new facility. So have you met any of the other staff, and can you share a little bit?
All of our team members have been hired. So that brings up we're a social model.
Yeah.
So it's a matter of having residents, no matter where they are, to be engaged throughout the day. And our philosophy is to inspire people to reach their full potential every day, whether that's in assisted living, whether that's a team member, whether that's in memory care. Because everybody, doesn't mean you're an older adult that their life stops living.
Right.
It's how then we can keep you engaged.
That's so important. I feel like so many people can thrive. What's your experience with people in a setting like this where they can thrive? Have you seen?
I have.
Can you share?
I've been working for the Alzheimer's Association for a little over 5 years. So I've been to many of our communities in Boca area, really. And I've seen how everyone does it a little bit different, but I've seen how great it is for the residents having that sense of community and having that socialization is just so important. You can see they light up when people come in to visit, even just to volunteer their time. Not that they're not having that when they're at home, but it's nice to see them. They're not just put away in their rooms sitting alone, which I think, unfortunately, a lot of people assume that's what it is, and it's not. It's really nice to be able to visit and be able to see the different communities we have.
You know, that's kind of breaking the stigma of what younger people think. So it's good to bring the awareness of how special this is, so people can see that people want to, you want everybody to thrive.
Yes.
Yeah. Yes. Is there anything else you wanted to share about your future visions for what your goals may be, or any future endeavors or plans you may have?
Well, our goals together is to really raise as much awareness and monies for the walk, which includes anybody that's interested in being a team member, in being a sponsor, in helping fundraise. They can reach out again to either Stephanie or myself in that way. If anybody does have a loved one that will benefit from being in a community setting, we think that Sunscape has that to offer.
Yeah, I agree. Just from meeting a couple of the team members, I feel that sense of community, that everybody seems so eager to have everybody be satisfied and to be, part of this community. And that's what you're doing. You're creating a sense of community, and that's what's really needed. So we really do appreciate that. Any other last things that you want to touch on?
Well, just that the walk is on November 12th.
Is that a Saturday?
It's
Sunday?
a Sunday.
Sunday, okay.
It is at the South Regional County Park at the amphitheater. And we're going to have the walk, which is wonderful, but then we're actually going to have a post-walk event too. So after you do the walk, stay. There'll be food trucks. There'll be music.
Nice.
There'll be kids zones. There'll be a lot of stuff to offer to spend your Sunday there with your family.
And what time does that start?
It starts at 8 o'clock in the morning. The walk itself will probably start around 8:45 or 9 a.m. once we do some opening ceremonies inside of the amphitheater. And then once everyone comes in, we're there for the majority of the morning and going into the afternoon and enjoy some lunch with everyone. It really is truly for the whole community. It's not just for those who are living with Alzheimer's. It's for anyone who has had it in their family, or maybe they even haven't been affected by it yet. But truly, it's for everyone. We want you to bring your friends, your family, your kids, come and enjoy the day with us, make a difference. All of the money that is raised goes towards the free programs and services, as well as research for the Alzheimer's Association. So, like I said, whether you have been affected or not, you're making a difference in our community with this.
Yeah, I love how you make it a family event, because it affects so many people, right?
Right.
Family members, it affects so many people.
Yes,
so
yes. And then for anybody that does have family members that does need memory care, to think about Sunscape. Again, we'll be accepting residents in September. And our Vallejo memory care community is absolutely lovely, and the care and programming that we're going to give and provide is far above, almost anybody else.
Thank you for that. And what I really like is that you have it in different options. So maybe they don't come in needing that, but maybe if they do need it down the road, they'll be able to
transition very seamlessly.
Right. And I think that's important, because to have to pick up a family member and move them to another location is it's a lot. So I like how you're able to transition that. Well, ladies, I want to thank you so much for joining us today, and thank you for all the information. It's been wonderful interviewing you.
Thank you for having us.
Thank you.
You're doing a great job, ladies. Thank you so much. And we're going to have a commercial break. Thank you, everybody, for tuning in, and we'll be right back.
All County Healthcare has exciting news for any and all patients with COPD or other respiratory ailments. Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy.
For further information, call All County Healthcare now at 954-717-7027. That is 954-717-7027. Or visit our website at allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Hi, everybody. Thank you for tuning back in with All County Healthcare. We have today Mr. Ed Salazar, who is a he's a respiratory therapist, but you're going to tell us all your titles because you have so many. Thanks for joining us today, Ed.
No, Louise, it's my pleasure.
We appreciate that. How long have you been doing this? And can you tell us a little bit more about your experience and your background?
Well, I've been a respiratory therapist since 1972.
Wow.
Seen a lot of changes in the technology, and I've worked, pretty much in all aspects of respiratory therapy care. But for the last 20 years, I've worked primarily as an independent. And I came to work with All County Healthcare because I was a distributor for a very unique form of ventilation. It's a high-frequency ventilation. It's called IPV, intrapulmonary percussive ventilation. And this is what has made All County, in my opinion, a very, very unique home health agency for the care of any kind of chronic lung condition. Most notably, people know about COPD, chronic obstructive pulmonary disease. They know about asthma. But, there are neuromuscular problems that can lend themselves to developing into pulmonary complications. Frequently people with Duchenne's muscular dystrophy, people with ALS. When their condition declines to the point where it starts affecting their pulmonary system, then, their failure to ventilate adequately becomes an issue.
Yes.
And that's one of the things that this therapy is so good at.
I'm so happy you believe in something, because you started out as a distributor for this, so that means it's something that you're really knowledgeable about and you believe in that. And I would imagine you've seen particular cases and experiences with maybe certain patients who've had some great results. Maybe you want to share that?
Right. Up until about 20 years ago, I guess, the technology was relegated primarily to critical care. Trauma centers, burn units, people with really complex problems. So then, physicians started saying, well, if it works on the highest acuities, it should work just as well on lower acuities. So one of the first places that it really shined was in the treatment of cystic fibrosis.
Wow.
Because now you've got a young population that have a very, very difficult, very complex pulmonary problem. And the technology proved to be outstanding in clearing it up. So
I'm sorry for interrupting. So for somebody who needs a treatment, how does that work? You would prescribe to them a certain amount of days, certain amount of times. You would go and set it up and do it for them?
Well,
how does that work?
Even before COVID, we established a protocol whereby typically a doctor would refer a patient to us that just couldn't effectively respond to conventional aerosols, dilators, steroids, things like that. So we would see the patient once a day for a week or two. And then we would see them every other day for a week or two, depending on how they progress and how compliant they are.
Right. Right. They have to do their part. You have to be
Right.
willing to
Right.
do their part.
And then they would be referred back to their physician for reassessment, and he would determine whether he would want them to go through another cycle of the protocol or not.
Wow. So how long does somebody, what would you prescribe, let's say a particular person, like is it like a 10-minute, 15-minute, an hour? How long do they have to do that?
Well, in order to be an effective treatment, it has to be at least 15 to 20 minutes.
Okay.
Because what the therapy does is it gives you very, very rapid but very, very small volume boluses of air. So it's discharging these little boluses of air at 300 to 450 cycles per minute.
Wow.
Okay, so for that to happen, when boluses of air enter your airway like that,
Right.
the path of least resistance is going to be down the center of the airway.
Right.
Even as the airways continue to get smaller and smaller and smaller and smaller and smaller, the path of least resistance is going to be through the center. Now when it reaches an obstruction,
Okay.
eventually those pulses are going to breach that obstruction, get behind it, and go on down to the alveolar level, you know, the little air sacs in your lungs.
Yes.
Now the air's got to come out. So the air's going to come out at the same time it's going in.
Wow.
So you have what they call a counter current. Now, if the air going in is going down the center of the airway, where's the air going to come out?
On the
Come out around
sides.
the walls of the airway, right? And it's going to come out in a spiraling motion. And this action, anything that is attached to the airways, is going to come out with the exhalation. So even if the patient doesn't have an effective cough, we can clear congestion out of their lungs.
Wow. So I imagine you've seen a lot of COVID, post-COVID patients.
Well, I'm very proud of the fact that during COVID, we made a presentation at Good Samaritan Hospital in West Palm Beach.
Nice.
And the caseworkers said, well, you know, we certainly got issues. So they started, every one of their patients that was admitted for COVID pneumonia, when they were able to be discharged, they put them in our care for follow-up.
Okay.
And in that period of time, not a single one of those patients exacerbated and required readmission.
Wow.
Now, typically in Florida, and this really hasn't changed since we've been tracking it, I think it's about 2013, about 8%, 8 to 9% of all patients who are admitted to a hospital for exacerbation of a chronic lung condition, 8% of them are readmitted 15 days after discharge.
Wow.
And that's what CMS is so upset about, you know, the insurance providers.
I see.
So with our program, they just don't get readmitted.
I'm surprised every hospital doesn't have this.
I'm amazed.
This to me is so amazing that, I mean, you had to do a presentation for Good Samaritan. I'm like, why wouldn't more of these hospitals? This sounds like such an amazing device.
Well, there are some of the hospital systems in South Florida are using it.
Okay, good.
Yes.
That's good.
Not all of them, but a good number of them are.
Okay.
Our challenge is for continuity of care, for a true transitional care program.
Yes.
To extend the care after discharge
Right.
at home, which is what all county does,
Right.
and then prevent exacerbations and readmissions.
So you go out and see patients in their home. Is that what you do? You or wherever they are, you go help them with the device, and you.
Right.
Nice.
We've, I've been tasked with training a team of nurses
Oh,
to
wonderful.
deliver the therapy.
Can you
And-
show us the device? Can you at least?
Well, I know we're on radio.
I know. Oh, true.
But
But
what you've got a nebulizer system here, and this is just supposed to simulate, you know, lungs, right?
right.
So when you first start it up,
Is there a medicine in there that you put in?
this is a little medicine bowl.
Okay.
So in here will go whatever medication is given
I
to the
see.
patient. And they'll get a standard aerosol treatment for a couple of minutes. And then you start,
Oh.
and here goes.
Yeah. Okay.
And that's what, I know, that's what affects the airway clearance.
Interesting.
And as I say, you know, the technology is nothing new about it. It's been around for more than 40 years now. but it had been primarily relegated to, critical care areas.
I see. Wow. So that's an amazing device that people are benefiting from. So thank you for doing such a great job at you doing your job and spreading the word and helping people, because that's what we need is more people raising awareness of things that are going to work.
Well, and this does work. We have not had one single physician who has taken advantage of our service. We have had not one single physician say that they would not use us again.
Mm-hmm.
And I believe if you go to our Facebook page, our Facebook page and our website, you can find videos, and you can find endorsements from not only patients but also from clinicians, professional caregivers, prescribing physicians.
Nice.
And we're very, very proud of what we've done.
I remember recently I did interview a doctor, and he mentioned that this device actually helped save a patient's life, and he was blown away by that. So,
well, that particular patient, I remember. That particular patient had been diagnosed with idiopathic pulmonary fibrosis, and it sounds scary.
It
right?
does, very.
But generally, when someone gets a diagnosis like that, it's a very, very grim diagnosis, and there's no cure for it.
Wow.
Well, but we said, well, we can at least make him feel better.
Sure.
So we eased his dyspnea, which is just a medical term for shortness of breath.
Okay.
And we improved his exercise tolerance to the point that, both he and his wife were amazed. Eventually, we got him off oxygen.
Wow.
He didn't need supplemental oxygen.
Wow, that's huge.
So when he went to see his doctor says, well, I think we better get another MRI.
Wow.
So they repeated his diagnostic studies, and he was getting better. Now, this told them we were wrong. This wasn't fibrosis.
Oh, wow.
And so they changed their thinking, and they looked, and they think that what he had was a variation on a COVID pneumonia.
Okay.
But it wouldn't have resolved on its own.
That's right. It would have gone worse. So thank you for doing such a great job. Thank you for coming on to the show.
My pleasure.
We
as
appreciate you. And thank you, everybody, for tuning in. And we will see you next week. And have a great evening. Take care.